Assessing functions and falls in the elderly. Learning objectives. By the end of this module, you should be able to, firstly, assess activities of daily living, which includes basic as well as instrumental activities of daily living. Secondly, understand why falls are important in the assessment of an elderly's function. Thirdly, perform a falls assessment, which includes finding out the reasons behind a fall, as well as the consequences after the fall. Fourthly, how to prevent the next fall. Now let's talk about the aging process. Aging is something all of us will go through if we have the privilege of growing old. A good understanding of the various physical changes that occur during the aging process and how it affects daily life can help us assist our elderly better. As we age, we have reduced mobility, meaning that we have more difficulty moving around and may even need a walking stick or a wheelchair. Aging also leads to reduced bone density, which means it is easier to get a fracture if we fall. Cartilage gets worn out over prolonged use, and this can cause pain, especially over the lower back and the knees. We may also not be able to feel as well as before, making it more difficult to perform previously simple tasks such as buttoning a shirt and picking up small objects. There are some things we can do to help our elderly. Exercise is important to improve mobility by improving strength and endurance. We can also make the household safer for walking to reduce the risk of falls and fractures. Thirdly, we should also keep an eye out for our seniors and help them with more difficult tasks. For the activities of daily living, or ADLs, it is a term used to collectively describe fundamental skills required to independently take care of oneself. It is an indicator of a patient's functional status, and it includes basic and instrumental activities of daily living. For each of these activities, it can be further classified as either independent, assisted, or dependent. The basic activities of daily living include getting out of bed, getting around the house, getting dressed, toileting, bathing, and eating. While instrumental activities of daily living include doing housework, laundry, preparing meals, getting out of the house, going places outside of walking distance requiring public transport, telephone use, taking of medications, money management, as well as grocery shopping. Why are falls so important? Falls can signal a transition from being ADL independent to requiring more assistance with one's ADLs. This loss of function also leads to poorer quality of life. Let's take Mr. Tan as an example. Mr. Tan used to be independent in both basic and instrumental activities of daily living and was able to get around without assistance and worked as a cleaner. He is not married and stays alone. He has hypertension, high cholesterol and diabetes, but does not take his medications or see a doctor regularly. He suffered from his first fall when he slipped and fell on a wet floor in his bathroom. He could not get up on his own and was found to have a hip fracture. He was admitted to hospital and required surgery. He became gradually weaker and started to require assistance in his instrumental activities of daily living, such as getting outside the house and grocery shopping. He also requires a walking stick when out of his house. He could not continue his job as a cleaner. He then suffered from a second fall due to a stroke and got a lower back fracture as a result. He eventually became weaker and now required a wheelchair for moving around and could no longer get out of his house. After a few months, his condition got worse and he needed to stay in a nursing home as he could no longer care for himself. He became bedbound and could not move around as much as before. A few months later, he caught a pneumonia and passed away soon after. As we can see, the loss of independence is a gradual process. Could his first and second fall been prevented? We will discuss this in our subsequent slides. Falls are usually just the tip of an iceberg and might signify underlying problems such as functional decline, poor vision, dementia, stroke, heart attack, and even neglect. And these underlying problems need to be addressed to prevent the fall. As we can see from the earlier example of Mr. Tan, there are many consequences of falls, both short-term and long-term. For medical consequences, falls can lead to fractures and immobility. If the initial fall is not discovered in the first 1 hour, it can lead to a phenomenon known as long lie, where toxic products from muscle breakdown stay in the body, leading to potentially fatal consequences such as kidney failure. There can also be prolonged immobility leading to bed sores, pneumonia, which is a lung infection, as well as urinary tract infection, as well as formation of clots within the body, which are potentially fatal. There can also be financial burden incurred from a fall, for example, due to a prolonged hospital stay. The inability to take care of oneself can also lead to emotional burden. Let's go through an approach to falls. Let's suppose you are going for a home visit to Mr. Tan after his first fall. What are the information you would like to gather to find out more about the fall? You would want to find out firstly the cause of the fall, secondly complications of the fall, and also you will also want to think about how to prevent the next fall. The contributing factors of falls can be broadly classified into intrinsic factors coming from the individual as well as extrinsic factors, which are environmental factors. Intrinsic factors include poor vision such as cataract, underlying heart problems which can have symptoms such as giddiness, chest pain, and difficulty breathing, and underlying stroke which can have symptoms such as one-sided weakness or numbness or unsteady gait, osteoarthritis of the knees which can present with knee pain. Medications can also contribute to falls. For example, in the case of Mr. Tan, there can be low blood sugar due to overdose of diabetic medications, and as well as low blood pressure from an overdose of blood pressure medications. Extrinsic factors contributing to falls include a cluttered house, wet floor, and poor lighting. We next need to look for complications of falls. We need to ask and look out for any head injury, and also look out for any loss of consciousness. We also need to look out for any fractures that can result from the fall. Next, we need to prevent the fall by addressing the underlying cause and also teaching appropriate exercises. Here are some questions we can ask to find out more about the fall. We can ask some background questions like how many falls Mr. Tan has had so far, whether it is a first fall or whether it's a recurrent fall, as defined by more than 2 falls in the past 6 months. We can then ask questions pertaining to the pre-fall, during fall, and post-fall circumstances. In terms of pre-fall, we can ask about whether there are the following symptoms. Cardiac symptoms such as giddiness, chest pain, palpitations, and difficulty breathing. Infective symptoms such as fever, cough, runny nose, sore throat, vomiting, diarrhea, or tummy pain. Symptoms that may suggest an underlying cancer such as loss of weight, loss of appetite, and tiredness. Neurological symptoms such as blurring of vision or one-sided weakness or numbness or unsteady gait. We can also ask more about what happened during the fall. For example, where did the fall occur? What time of day was it when the fall happened? For example, if the time of day was after midnight, we can be worried that it might be due to poor lighting that led to the fall. And we can also ask about what exactly happened during the fall, whether the lighting was bad, and whether the floor was wet. After the fall, we can also ask whether there is any head injury, loss of consciousness, and whether Mr. Tan was able to get up on his own. Next, we can perform a physical examination. We can perform a blood pressure check and check the heart rate and temperature, and also do a head-to-toe check for fractures. by feeling for any long bone tenderness and any limitation of movement across the joints. We can also listen to the lungs to look out for any lung findings that can suggest an infection or maybe even an underlying mass. We can also do a full neurological examination, especially looking out for any weakness of any part of the body as well as any loss of sensation. We can also get Mr. Tan to walk to see how steady his walk is, and also see whether he requires any ambulatory aid such as a walking stick or walking frame. Using the information we have gathered from the questions as well as physical examination, we then come up with an assessment of Mr. Tan's fall. We will want to know whether his fall is a first fall or whether it's a recurrent fall. We also want to know whether there are precipitating factors leading to the fall, such as a wet floor in Mr. Tan's case, whether there are predisposing factors of the fall, such as a previous stroke or poor safety awareness. We also want to look for complications of the fall, such as any head injury or any fractures after the fall. There are several interventions that have been proven to reduce the risk of falls. For example, exercises such as Otago as well as Tai Chi have been proven to improve strength, balance, coordination, and resistance, and thus reduce the risk of falls. If indicated, cataract surgery can also improve eyesight and also reduce the risk of falls. We also need to look into fracture prevention by doing a bone mineral density scan for osteoporosis, as well as supplement the diet with calcium and vitamin D. We can also prevent falls by looking into the extrinsic factors that lead to falls. We can also look into home modification, for example, introducing anti-slip mats in areas with slippery floors such as the bathroom, introducing grab bars in the bathroom, ramps if there are any steps, removing clutter, and ensuring good lighting. This is an example of how a previous group in Trigen has helped an elderly called Madam Lim to prevent falls. We notice that there is a long walkway from her bathroom to her bedroom that is not lighted at night. So we introduced a motion censored light that would be automatically lighted up when she passes by at night to go to the bathroom to reduce her risk of falls. Now let's apply what we have learned so far. We are visiting Mr. Tan, a 65-year-old gentleman living in a one-room flat. You are tasked to perform an environmental assessment of Mr. Tan's house to find out why he has been falling so frequently. Identify as many fall hazards as you can and discuss what you can do to prevent future falls. This is Mr. Tan's living room. Which are the fall hazards that you can identify? Let's see if you manage to identify all the fall hazards in Mr. Tan's living room. There are slippery mats and rugs, presence of clutter, electric cords across the floor, poor lighting, unstable furniture, unstable chair, difficulty in accessing the light switch, as well as little space to maneuver around. Let's summarize what we have learned so far. We have learned how to assess activities of daily living, which can be divided into basic or instrumental. Basic activities of daily living include dressing, eating, ambulation, toileting, and hygiene. Instrumental activities of daily living include shopping, housekeeping, accounting, food preparation, taking medications, telephone, and transportation. We have also learned how to conduct a falls assessment, which includes finding out the cause of fall, which can be either intrinsic or extrinsic, identifying the consequences of the fall, as well as falls prevention. Now let's come back to Mr. Tan. This is our 65-year-old gentleman who was initially ADL independent then suffered from 2 falls, leading to gradual loss of independence. What were his causes of fall, consequences of fall, and how do we prevent the next fall? In terms of causes of fall, for intrinsic factors, we note that he has poor control of his medical conditions such as hypertension, hyperlipidemia, and diabetes, which might have led to the stroke, leading to his second fall. We also know that he had a slippery fall in his bathroom, leading to his first fall, as well as multiple clutter in his living room. His consequences of fall can be divided into both short-term and long-term consequences. He suffered from multiple fractures from his both falls, leading to gradual immobility as well as a pneumonia. In terms of preventing his 2 falls, it would have helped if he had good control of his medical conditions, including hypertension, hyperlipidemia, and diabetes, and took his medications regularly, saw a doctor regularly, and took care of his diet and exercise. He could also install anti-slip mats in his bathroom and reduce clutter in his living room. We could also screen him for osteoporosis to reduce the risk of future fractures. How can we apply what we have learned in this module to the community around us? Let's start from the people closest to us. Think of an elderly you know, such as your grandfather or grandmother. Has he or she fallen before? These 3 contributing factors that led to the fall. Remember, these factors can be either intrinsic factors or extrinsic factors. Next, what are 3 ways you can empower him or her to prevent the next fall? Discuss your answer with your facilitator.